As part of Scotland's National Dementia Strategy, there has been an initiative to prepare health and social care staff as dementia ambassadors and champions. The ambassadors and champions are drawn from a broad spectrum of health and social care disciplines, including nurses, social workers and allied health professionals.
I absolutely love being a dementia champion.
I was very excited when I got picked to go on the course. It's given me such opportunities to link with other champions and to work with nursing and allied health professional staff.
Great opportunity for the department to have somebody, and it's a key role that needs to be in every accident emergency department.
By becoming a champion, I felt that I could bring things forward and move things on with inside the department.
It's important to have that person-centred approach where you're looking at what the person requires and how we're going to manage to meet their needs.
Personally, it means that I'm going to be able to develop my knowledge and skills, but also I'm ideally placed as somebody within workforce development to then be able to pass that on and cascade skills to other people.
We all have the same goal. We're all trying to improve the practice of our staff, make change, improve knowledge and skills, and ultimately improve the outcomes for people with dementia, their families and their carers.
It feels great. It actually feels fantastic to make a change in somebody else's life.
The training prepares the dementia ambassadors and champions as agents of change and brings about continuous improvement in dementia care practice within their own service beyond the life of the programme.
We know that we have an ageing population and dementia treatment is getting better, so we know that people are living longer with conditions such as dementia. So for me, working across adults and older people, that's a huge area of our work. It's going to have a massive impact on the staff and the training that they need to have, the kind of knowledge and skills base that they need to have to provide effective care.
Unfortunately, people with dementia have tended to be grouped together. Yes. And people expect the same responses and things from that individual, and I think it's really important that they recognise everyone is different with, with dementia, that they are individuals and they should be treated accordingly.
Achievements, improvements and change are possible and happening at every level, through strategy, systems, practice, but most of all through the way we all engage on an everyday human level in our work with people with dementia.
Over the last 12 months, there's been lots of achievements. The Dementia Champions have introduced a whole range of different improvements.
We've been actually rolling out dementia awareness training across the department, and the feedback from people about the changing and the raising of awareness for them has been really gratifying, if you like.
Since being a Dementia Champion, along with my colleague from the elderly mental health team, we have been doing cognitive testing on the over 65-year-olds. It's 4 very simple questions. If they're scoring less than 4, then we know that we need to give them a certain level of care within inside the department.
Through doing the Dementia Champion programme, we spoke about the This Is Me document. That's something that is used quite a lot in hospitals, but as social work we don't tend to use that in the community. And I felt, and I always have felt, that it's very important to get to know the person, because at the end of the day you're working with the person, not with the dementia. That's secondary.
This is the document that informs staff of patients' likes, dislikes, and this is what care plans should be developed from the information that you get from this. The Dementia Champions have been the key to rolling this out across Ayrshire, and without them it just wouldn't have happened. This is going back to basics. You can't care for someone unless you know them, and this is how you get to know them.
All over Scotland, ambassadors and champions are making a difference.
One of the things we've done on the ward is introduce a scheme called Partners in Care, and this is a way of getting families and loved ones to be actually involved with the patient's care whilst they're here during an acute stay in hospital. It's brilliant, yes, we love it on the ward. It's a way of us communicating well with families, it builds up trust, it actively helps them become involved with their people with dementia, with their care. and helps with the recovery.
We've developed an intranet site for dementia so that staff can access a whole range of resources about dementia. There's things about pain on there, about environment, improvements they can make to the environment, around education, adults with incapacity, and it's a central point that staff can go to get that information that they need to improve the care of people with dementia.
The role of a dementia champion is great. Getting other people on board is very difficult, especially in a busy A&E department, which is why I came up with an intuitive idea to get people on board. I introduced the Dementia Box. The idea of the Dementia Box is to take it apart and to get people to rebuild it. By doing that, you're asking lots of questions, you have a noisy background which causes stress and distress to the person that's trying to build the box, which is exactly how somebody with dementia feels when coming into the acute setting. The Dementia Box has been a great success. People are interested in the box and it's made great improvements towards people with dementia.
Our hospitals and care environments need to be welcoming and enabling for people with dementia.
We've also introduced signage in the care home which assists people to find their way around, particularly when people are trying to access, say, a dining facility or something like that, without having to ask someone all the time or being frightened to sort of go places because they're not sure how to get there. What kind of things have you done?
Well, we've done that. We've actually done that as well, so that the toilets stand out, people's rooms are there, they can have a picture or the name that they like to be called on it, or they can have memory boxes. There's lots of ways that you can assist people find their way around.
This is what we call a memory box, and basically it's a box of items that are used to simulate persons' memories of their earlier life, instigate conversation. The patients can rummage through it passes their time, and we also encourage relatives to bring in items that would be useful as well.
So this is the Forget Me Not sign, and this is one of the initiatives that we brought from the dementia group, and basically it's just a simple way of identifying to staff that the patient's either got a diagnosis of dementia or they do have cognitive impairment. I do think it's really good. I think it's great that we've managed to roll it out and all the wards have taken it on board.
This is something else we've introduced along with our ambassador work. This is our sensory room or our reflection room. It's a very quiet room, very plain walls. We have lights, we have a glitter ball, we play soft music, we also have aromatherapy. It's a lovely room for people to calm down, either to chill out or de-stress.
This is Ward 41's Dementia Board. It's an information board, and it's written in such a way that it can be utilised both by staff and by relatives.
I've often seen relatives stop in, the different colours attract them, and it just gives them a bit of information in layman's terms, what is dementia, and a bit about capacity and about power of attorney and how they would seek that and the types of dementia.
The red jug and beaker's been a really positive step on the ward because it helps identify patients who need assistance with drinking, and it also helps them see, because a lot of time older people have perceptual difficulties or visual difficulties, and it means that when it's red it stands out more so they can see it, whereas if it was a clear beaker they just won't see it at all. So it has improved fluid intake in our patients on the ward.
There's an increasing network of health and social care staff leading the way, but we all need to be involved. Working in collaboration with each other and with people with dementia and their families is key to success.
Today's training was it's a mixture of social care staff and health staff, and learning about the level 2 promoting excellence, so it's dementia skilled level.
Talking together what techniques people used already, and then building what we learned on the Dementia Champion programme into that.
There was an opportunity for both staff from health and social care to come together, different perspectives, looking at joint working and how we can work collaboratively.
As a dementia champion, one of the first things I did as part of my role was form a group, and this group was made up of colleagues who approached me because they also had a keen interest in dementia.
We've had loads of help through the Dementia Champions programme because of the University of West of Scotland and NES and Alzheimer's Scotland. They've given us brilliant resources, and we've utilised them and shared them and done our best to share them with our colleagues.
When I undertook the Dementia Champions training, I was in the first cohort of the programme, and through doing that there was other nurses and allied health professionals that undertook the programme with me.
We have developed a link group for all the Dementia Champions that are working within NHS 5 that have been trained so far, and we meet monthly as well. And that's a great way to network.
What one nurse might find a challenge, another nurse might have the solution for. So we're able to use that network to link together and kind of overcome some of these things.
We've had a really good, close-knit relationship with other Dementia Champions within NHS 5, and that has certainly helped the process. So yeah, it's nice to be part of it all, really.
People with dementia and their families have the right to expect more of us. We are making progress, but there is so much more to do. Small steps matter and can make a huge difference.
We're really immensely proud of the champions that we've got. The work that they've done today is just absolutely fantastic.
The Dementia Champions ambassadors have made a big difference. It's certainly raised the awareness of dementia and making staff think about that as an integral part of their practice now.
It's made me a lot more aware of how my behaviour, my communication techniques can affect every patient that I see, whether they have dementia or not.
This has been proven to be absolutely essential, just to ensure that we get things right when we're caring for the person with dementia and their families.
These timely discussions with individuals when they can still make choices is really important, so that when they lose that ability, we can act on their wishes.
It was a really good opportunity to look at many different aspects of dementia that we may not have looked at previously, specifically as an OT.
It makes me feel great because I know that somebody's life out there is potentially affected not only by our staff who have great values and attitudes anyway, but to know that giving somebody a small piece of information changes the perspective that they have, and then ultimately can result to better standards and quality of living for people out there.
I know that for me this is just a beginning of a journey.
You make a small step, then that step gets bigger and bigger, and then it starts to carry on and roll on throughout the department. Start off with a small group of people, then other people get on board, they see these people getting on board, oh, I might just join in on that. And then before you know it, you've got a good department which is dementia friendly.
Well, if they've just become a champion, I'd be saying congratulations, because it's not the easiest thing to do, and I think it's fantastic that they've come through the process and they still have all their enthusiasm. For anyone who's thinking about it, go for it. Don't think anymore, just do it, because the more we can get on board, the better.
Improving the care of people with dementia is everyone's business, and we are so grateful to the ambassadors and champions for making it happen.